Ask Dr. Ammar. Replacing missing front teeth organically without fake teeth.
Hey everyone, this is Dr. Ammar from Elite Orthodontics again. I wanted to talk today about a very important topic, missing adult teeth in the front area. A lot of the time we see those cases in our practice. Could be adults, could be teenagers, or could be even younger than that. Very important that we know how to manage those cases. Sometimes you might hear different opinions, and as a patient you will say, I don't know which one is right or wrong. And I will tell you a hint to learn. Always seek for the organic option, the option that you can keep natural teeth, natural bone, and natural support for your lip. Usually this is the best option to do for a patient. All of the options will have a little bit shortcomings, but we have to compare the pros and cons between all the options and make that decision. Now, in cases like the one that I'm showing you right here, which is an actual case in my practice, and I'll show you how it looks like at the end of the treatment. This patient was 24 years old. When she was 12, she had a missing adult lateral incisor on the top right side. She has been referred by her dentist to an orthodontist to open a space for a future implant. Why? Because you cannot do implants early in life unless you are very clean matured, usually around age 19 to 21. Idea for that is to open the space and let the surgeon explore if the bone is good enough, or if not, they can try to come up with a strategy to build better bone. Now this has a lot of limitations. You can't just grow the bone out of nothing. So in those cases, they end up deciding, okay, the smile line is showing too much. Maybe we cannot do the implant because of how thin the bone is, and you end up having a bridge. A bridge is connecting multiple teeth together. It is a way of treatment, but it's always going to cause damages to the adjacent teeth and it's trying to imitate how the natural teeth are going to look like. And it's always, as I've seen in my clinical experience, end up having some gum issues around the bridge. Sometimes it doesn't look perfect and nice around it. So that's a shortcoming we need to know about doing those cases. Now, in a case that comes to my practice like that, just like this case, usually I prefer to close that space. So if I've seen this patient when she was younger, I'll just slide all the teeth from the back to forward, keeping the midline under control. That requires tremendous orthodontic control. Some orthodontists don't have the intention or the desire to do that, and some orthodontists enjoy doing that. Now, you make your choice and selection. But in a cases like those, when you slide the tooth in a place, you'll actually bring a good bone with it. And then you will leave the canine, which looks a little bit off from the other tooth, which is this one. And sometimes a good camouflage in the position with a little bit of restorative work on it makes it very hidden to the limit that the normal person who sees you smiling will not know that you're missing a tooth. This patient waited until she's 24. She went to the dentist. Dentist tried to put implant, and 3 times the implant couldn't hold because the bone was not good enough. Then she saw a specialist in gum and bone, and that's how it was introduced to my practice. Could we have other options? Because the other option we could do is a bridge. And the patient was very professional, didn't want it to go through all of that. And she kind of did her due diligence, understood what a bridge means, damaging the neighboring teeth. First to get a support, and second, they use that a lot in restorative dentistry, trying to make everything kind of looks the same, so they end up doing it the whole 4 or the 6 teeth in the front as veneers or crowns. Now, in this case, I treated it a little differently. We were able to slide the back teeth forward, not just fix the cosmetic problem, but we actually were able to slide the teeth forward with the bones, support the periodontium much better for that upper left canine, close that space. The patient was extremely happy that we did not even need to do any restorative work on it, because she was extremely happy and accepting that little difference between the teeth, but knowing that she will live all her life not to worry about an implant that could fail or a bridge that could progress to damage more teeth as you get older. This is a very important message. I want to everyone to understand when they see such a situation in their family members. Do not just take that opinion of only implant as the option. But there are options. Always look for them, understand what other options before you make a decision. This is how the case ended up. So it started with this missing teeth and developed to this situation. This is what's very important for me to do, is I kept organic teeth, moved teeth in place. Patient was able to smile and perform happy smile with organic teeth and keep them natural. Thank you. Have a good day.